Exercises are the best way to get long-term relief for your wrist pain, but only if you do them a specific way to achieve a specific physiologic outcome. In this video, I'm going to go over exactly why exercises might not have been beneficial for you and why there might have been an increase in pain when you started doing the exercises. I've already tried exercises before and they didn't help. The pain only got worse after doing exercises. The program they gave me was just exercises for the wrist and hand. Over the past 8 years, we've worked with thousands of individuals who have all told us this many times. They've attempted some form of exercise in the past and have written off the benefit of performing exercises for their wrist and hand pain. When we explored more about their previous history with exercises, we found 4 things. 1, they performed only 3 sets of 10 for a few exercises and focused on building strength. 2, stretches were the only exercises they performed. 3, they were only consistent for a few weeks. And 4, the pain increased after trying the exercises. Exercises are beneficial when they are applied in a specific way. They can be performed for strength, coordination, flexibility, agility, balance, speed, and of course, endurance. For the patients that fell into situation number 1, a majority used an appropriate weight, which is between 3 to 5% of their body weight, but were only asked to perform 10 repetitions. This is not enough to facilitate endurance adaptations. 15 to 25 reps per set is recommended, and if you can tolerate it, performing the routine up to 2 times a day. Exercises themselves determine what muscles we target. However, the way you perform them allow you to achieve different physiologic benefits. You don't need strength at our wrist and hand for small repetitive activities. You need endurance. And so performing the higher overall repetitions allows you to achieve the tissue adaptations that will improve your tolerance to repeated stress over time. For those in situation number 2, the focus was just on flexibility. Muscles do tend to stiffen up in response to an injury as a protective mechanism to avoid continued tissue stress. And this is often why stretching can help in the short term. But again, it does not address the underlying problem. Instead, you need to build endurance, and you need to also improve coordination or brain to muscle signaling. Within our programs, we tend to utilize tendon neuroplastic training protocols, which utilize a metronome or external pacing and higher overall repetitions to achieve this outcome. And these protocols are based on the current tendinopathy research, but over the past 8 years, we've adapted them to injuries of the wrist and hand, since most research has been done on the lower extremity. With the TNT protocols, it's been shown to reduce pain because it can improve the signaling between the brain and the muscle tendon complex. And so this can address those who fall into situation number 4. I'll be explaining a lot further in detail why pain can sometimes increase in response to doing some exercises. But you have to realize with any exercise, it takes time for the tissues to adapt, which accounts for situation number 3. And the research shows that it can take up to 4 to 6 weeks for changes to occur. And this doesn't mean that progress won't be noticeable, as nervous system changes typically occur within the first 2 weeks. So again, exercise selection helps you determine what muscles we target. But how you do the exercises within the context of your lifestyle allows you to make progress with your pain. So the sets, reps, the volume, the frequency, the cadence at which you're performing these exercises will allow you to achieve specific results depending on how you modify those variables. As I mentioned, it is normal to feel an increase in pain temporarily with the exercises. Everyone has their own unique case of wrist pain. Their individual lifestyle, physical conditioning, work and activity demands, environment, beliefs can all lead to a completely different profile and presentation of pain. And for the cases we've seen with an initial increase in pain, it's usually due to the following: extended amount of rest, bracing, or repeated interventions in which the gamer or individual limited the amount of stress on the muscles of the wrist and hand. That led to overall deconditioning and weakness of those same muscles and tendons. And that often was repeated in a cycle due to recommendations from doctors. So they reduced the pain, then the pain returned often worse than before, then they rested again with some maybe medication and some other passive intervention, again causing their muscles to get weaker and weaker and weaker. And all of those things do nothing to address that underlying cause of endurance or capacity of these tissues to handle repeated stress. And to provide a reference point, most individuals are able to do around 10% of what is considered normal of their muscular endurance. So basically the ability to do between 40 to 60 repetitions of a movement, challenging that muscle group at around that 3 to 5% body weight. And that's extremely weak. And that's a reason why they get pain from just typing and low level activities. And it also means it will take some time for them to get back to 100%. But not only that, the exposure to some exercise can cause the muscle to feel extremely fatigued and even more painful. And that sensation can often be perceived as the condition becoming worse from exercise, when in fact, it's a normal response to what the muscle and tendon tissue needs. Listen to this next part. When we feel more pain, what we do and what we believe from this exact point has a large impact on our overall recovery progress. Let me illustrate. Individual 1 might believe the tissue is damaged further and then further avoids the exercise. This person believes the pain is a reflection of the state of the tissues, and I'm going to link in the description why that's never the case. Pain is never about the state of the tissues, it's always about protection. A lot of the current pain science literature goes over that. And as a result, individual 1 might go back to the doctor and re-enter referral hell, more confused than before and frustrated that the exercise didn't work. Individual 2, this person understands that an increase in pain is normal since they have been sedentary for several years of their life, or at least in the past 4 to 6 months, they had not been exercising regularly. This person also recognizes with the low levels of physical activity and repeated stress from work or gaming led to their current level of physical health. And because of this, they remind themselves it's part of the process. And sure enough, after a few days of exercise, it seems a bit more easy and progress seems a bit more tangible. Person number 1 and person number 2 have completely different recovery timelines. Individual number 1 may not ever make progress until they work with a physical therapist directly who helps them understand this. And while these scenarios only cover the exercise component of the recovery program, it's also important to remember what you do on a daily basis can impact the muscular activity of your wrist and hand, which means more stress. Those are the 2 main things we can really control when it comes to managing our wrist pain. Again, it's how much stress our tissues can handle with exercise, our endurance, and 2, how much stress we apply on it with activity. And so hopefully this video helps you understand why exercises may not have helped you and why there may be an increase in pain. And if you want to get a specific exercise program for your issue based on your level of conditioning, check out our troubleshooter. It's already helped over 200 plus individuals. And to briefly go over how it works, it starts by determining your level of endurance, then providing you with a personalized program based on your performance and other individual considerations. It also includes a tracker to help you follow your progress, and most importantly, you get 24/7 direct access to 1 HP injury specialists. Check the first link in the description if you want to check that out, or if you want to learn more about the science of RSI, watch this video right here.